My name is David Kau. I'm a stand-up comedian, filmmaker, and many other things. I'm a dad, I'm a husband, and those are probably the most important things to me.
My name is Uzamayecha. My surname is Peter. I'm an advocacy communications specialist and I am a communications manager for a youth network called Activate Change Drivers.
My name is Khotso Sotwani. I'm the special projects manager at Activate Change Drivers. So we are here today at the Nelson Mandela Foundation for the Men's Mental Health Indaba.
Guys, we are at the Nelson Mandela Foundation Center of Memory. So don't freak out. Every now and then you might hear when you're walking around. You might be in the toilet or bathroom and you just help us in your hands.
So this is an initiative of Generation G, which is a program that works towards promoting gender justice and preventing gender-based violence. So Generation G is a global partnership of around 7 countries, including South Africa, Indonesia, Uganda, Rwanda, Morocco, and a few other countries.
Here we had more than 150 men gathered to come discuss what it looks like to be a man in South Africa, to be a man in the continent, to be a man in the world, to discuss mental health and its impact in men, particularly within South Africa.
If you are not well, because what you want from mental health is mental wellness.
I'm a man. I'm a man. I'm ready to lead. I'm ready to lead. Love, love, and protect, and protect.
In order to realize a gender-just and a violence-free society, we need to coexist with healthy men. And we believe that healthy men are not born. They're raised and they come from the communities that they are raised in. So the shirt is written Shoba for Grand, and that is really an entry point into conversations. What we are doing with this t-shirt is we are saying, hey dude, are you okay? And if you are not okay, can we have a conversation about that? We are also saying, let's normalize asking, dude, are you okay?
That is why as a collective, we thought we should bring together men and have them look at their own issues, but beyond that, to say how can they work together towards addressing gender-based violence as allies in this fight.
We had a very full day of activities. We had a keynote address, we had a physical workout, an art station, we had, barbers come from Sobe. We had a whole lot of activities where we had even, medical doctors from the Gentleman's Clinic come and discuss what it looks like to live with mental health, what it looks like to deal with depression and anxiety.
Hey, I'm Vishay Naidu, one of the other doctors here in Gentleman's Clinic. I'm actually one of the Mtondo doctors.
We had Ntate Jerry Mufokeng as well, who's an activist and an actor who has spoken about fatherhood issues.
Something's keeping you awake at night. And when you talk about wellness, there's a Sesotho hymn that says, Mele pelo le moy. Body, soul, and spirit. All 3 compartments must have a relative equilibrium.
Nick Nzama, who runs the Boys to Men Foundation. We had also the Cool Dads Foundation, who are looking at how can we promote positive fatherhood, how do we engage men more meaningfully for them to be part of their families and to play a meaningful role in families.
We're so excited, we're so happy to be here, and we're so grateful to all the partners, all the organizations, all the men who were in the room.
And we are looking forward to engaging communities. That is at the core of our work as Generation G, to mobilize public support, but beyond that, educate communities around how they can respond meaningfully to challenges of gender-based violence.
It is our hope and it is our, aspiration as a network to realize a gender-just society. And we agree that, we can't realize a safe or a healthy society if we don't coexist with healthy men.
Currently in South Africa, it's a very well-documented stat, and in fact, globally, that male suicide rates are higher than women.
And when we are talking about mental health and suicide, the World Health Report indicated that of the 13,000 suicides reported in South Africa in 2019, more than 10,000 of those were from men. And so we are dealing with a crisis.
Men don't see an outlet. Men don't even cry for help. It's not like guys are trying to overdose and kill themselves. They want to get the job done. And they don't feel like they have an outlet.
You have to look after yourself, especially men. At least there's some sort of an outlet if you want to talk to someone. And for me, I always say to people, if you can start, you are halfway there.
Sometimes we just assume men are okay, they can take it, it's okay. But we are taking a pause, we're taking a moment, and we are saying, dude, are you okay? And we are saying that while the problems come from our society, so do the solutions. Let's just create a space and an environment where we can be human, where we can provide and make room for each other in our full diversity to say, Shoba for Brand.